Hi, my name is Kaytlena Stillman, and I'm currently an emergency medicine physician at Cedars-Sinai Medical Center in Los Angeles, California. I will be presenting this module on neighborhood and built environment. Here are our learning objectives. By the end of this lecture, you will be able to describe the components of the neighborhood and built environment that contribute to health inequities. You'll also be able to identify health disparities by zip code among your own patient population. You will also be able to identify local and national resources that address disparities caused by the built environment, and you will be able to describe an example of a neighborhood level intervention to address health disparities. Our agenda will be first, we will start with definitions and case examples. We will then move on to an activity where you will explore the zip code that you live in and compare it to the ones that your patients live in. And then finally, we will talk about some recommendations for emergency physicians. I have no conflicts of interest to disclose. So what is a neighborhood? A neighborhood is a spatial and cultural entity combining the ideas of a particular geographic area and the repeated social interactions of people and communities in that geographic area. A neighborhood can be defined geographically or culturally. Often, research uses defined geographic areas to describe neighborhoods, such as zip codes, although these definitions may inaccurately represent the distribution of resources within a community. For the purposes of understanding how the built environment influences emergency care, we will be thinking about neighborhoods in terms of geospatial regions. There are many components to the neighborhood that influence an individual patient's need for emergency care, and we will discuss these further in this module. Take a look at this picture here. What do you notice about this neighborhood? It appears to be a suburban neighborhood, and it is very clean. There are lots of trees and green space, and there's also a stop sign, crosswalk, and sidewalks, which are safe for pedestrians. There are wide streets with easy parking, and there is a drainage system for heavy rain. Furthermore, the quality of the homes appear to be excellent. Now compare that to this neighborhood. What do you notice here? This is an urban neighborhood with hardly any trees or green space. The streets appear to be quite narrow to the point where cars actually have to park on the sidewalks, making it dangerous for pedestrians. The housing is very condensed as well, and the neighborhood is in close proximity to a major bridge with car traffic. You may also appreciate that there is an abandoned lot behind the homes in this neighborhood. The physical differences between these two neighborhoods are what we call the built environment. The CDC defines the built environment as the physical makeup of where we live, learn, work, and play. This includes our homes, schools, businesses, streets and sidewalks, open spaces, and transportation options. The built environment can influence overall community health and individual behaviors like physical activity and healthy eating. There are several components of the built environment, which we will discuss here. Transportation infrastructure. Transportation infrastructure refers to road types, curb cuts and ramps, intersections and crosswalks, traffic control, and public transportation. Transportation infrastructure not only determines the ease of access to locations that promote health, like hospitals and clinics or pharmacies, but we also know that neighborhoods that are in close proximity to large freeways may increase exposure for their residents to toxic chemicals from car exhaust. We know from the literature that proximity to air pollutants, both at work and at home, have been linked to increased exacerbations of respiratory illness. Walkability and bikeability. This refers to access to safe, attractive sidewalks and paths with inviting features, bike lanes and paths, and green space for exercise. We know that these types of features promote healthy activity like exercise, but we also know that access to safe and inviting physical features like this have other public health implications. For example, blight remediation of buildings and land, like greening of vacant lots in urban spaces, can reduce violent crimes in communities. Housing infrastructure. When we think about housing, we think about availability, meaning sheer volume of housing, accessibility, like price of housing and distance from work, quality of housing, referring to plumbing, electricity, privacy, etc., and safety of housing, which refers to structural integrity, mold exposure, lead paint, asbestos exposure, just to name a few. There's another module in this curriculum dedicated to the relationship between homelessness and health and emergency department care. But it's important also to consider the quality and safety of housing for our housed patients. For example, living in public housing in New York City has been shown to be associated with increased odds of ever having asthma. Also, exposure to substandard housing has been linked to increased pediatric ED visits for asthma. Food environment. This refers to access to grocery stores, convenience stores, and farmers markets. Access to healthy food can affect risk for chronic disease burden. Neighborhoods that have poor access to these healthy food options are referred to as food deserts. In Texas, Baylor Scott and White Health System provided low-cost healthy food services to communities in food deserts in their area, and they actually saw a decrease in ED visits the following year. Next, we'll talk about threats to climate. This refers to proximity to traffic corridors, as we previously discussed, location of factories within the neighborhood, poor waste management, and urban heat islands, which are densely populated urban areas where asphalt, dark roofs, brick, and metal absorb heat and create areas that are hotter than others. It's important to remember that climate change is a civil rights issue. It disproportionately affects Black communities. In 2021, unprecedented storms hit Jackson, Mississippi, which is a primarily Black and low-income community, causing power outages that left over 100,000 residents without water for weeks. As we continue to see the effects of global warming, we will likely see the health manifestations of global warming present in our own emergency departments. And finally, access to schools. This determines safety for children and accessibility of education for all. This is important because we know that educated adults are healthier and have lower mortality rates than those less educated, so access to education is crucial. Let's now do an exercise exploring zip codes. Use Google Maps satellite view to compare the zip code in which you live to a zip code in which your patients live. Try to identify as many similarities and differences as you can. Ask yourself some of these questions. How condensed is the housing? Are there an adequate amount of sidewalks? What is the quality and quantity of green space? Where is the nearest grocery store? And is the neighborhood in proximity to a major freeway? Identify as many of the differences and similarities as you can, and see if you can also connect those differences and similarities to the health impacts that we discussed previously. You may now pause the video for a few minutes to do this exercise. Now let's talk about a few cases. The first case is a 10-year-old female who presents to your emergency department with her mother for shortness of breath. She has a known history of asthma, and she's taking her medications as prescribed. On exam, you are concerned that she is in respiratory distress. She is tachypnic and hypoxic to 90%, with poor air movement and faint and expiratory wheezes throughout. She has mild improvement with medications and CPAP, so you decide to admit her to the PICU. But just prior to PICU admission, you obtain more social history from mom, who states that she's currently very concerned because she and her daughter just moved to a new area that is near a major freeway with high air pollution, and she thinks this may be contributing to the frequent asthma exacerbations that her daughter is experiencing. You decide to contact your social worker to assist with housing stipends to find alternative safe housing for this family. Other solutions could include discussing with medical legal partnerships if available, or referring this family to community organizations within your area. The second case is a 32-year-old male who presents to your ER with nausea and fatigue. It's mid-July in the city. This patient's vital signs are normal, and his exam is relatively unremarkable, but his labs show mild hyponatremia and hypochloremia, consistent with mild dehydration. You decide to give this patient IV fluids, and he reports that his symptoms are improved after the IV hydration. You prepare to discharge this patient home with a diagnosis of heat exhaustion. However, just prior to sending him home, you ask him a little bit more about where he lives, and you realize that this patient likely lives in an urban heat island. You educate him about the importance of oral hydration and the prevention of heat stroke prior to discharge. Here are some recommendations for you as an emergency medicine physician. First, consider the built environment in both your differential and your management and discharge plan for the patients. Be aware of the built environment your patient is discharged to and discuss strategies for ways they can complete the post-discharge plan within those constraints. In the previous case, you discussed the importance of oral hydration and educated the patient about urban heat islands prior to discharge. This is an example of that. Next, refer to community resources and/or medical legal partnerships within your area. It's crucial that you know and are familiar with the community resources at a local level so that you can refer your patients from the emergency department when needed. Support community partnerships that respond to limitations of the built environment. We've heard about some examples of community partnerships like food prescriptions in food deserts, but there are lots of other community partnerships that you should be aware of both on the local and the national level. These could include greening organizations, housing justice organizations, or environmental and climate justice organizations. Finally, if you notice health disparities caused by the built environment in your emergency patient population, harness your hospital resources to champion a community project and make a difference. I'd like to thank Dr. Molly Curtis for helping me compile these slides and this information, and I would also like to especially thank Dr. Gina South for her expert review on this topic. Thank you.